Well, let me make some introductory remarks. First of all, thank you for joining us, all the participants and the audience for joining us on this panel discussion on COVID-19 in Latin America. I think this came out of the idea looking at a few countries in Latin America. If you follow the news on Latin America, you notice that there's very different outcomes taking place, and so it seemed really interesting to have people that look at particular countries more closely discuss what is happening with the pandemic in the region. So we have Professor Elliott Young from Lewis and Clark History Department joining us. He works mostly on transnational cross-border history, actually. We have Professor Shawn Smallman from the Department of International Global Studies at Portland State University, who has worked significantly on pandemics precisely prior to the outbreak of COVID-19. So he has deep knowledge on the issue, on global health issues. And then myself, Leopoldo Rodriguez, joining also from the Department of International Global Studies at PSU. So I want to invite the participants to first listen to the panelists. About 10 or 15 minutes each of us will give a presentation. Professor Young will talk about Cuba and Mexico, Professor Smallman about Brazil, and I will speak about Argentina. And then we'll open up for people to ask questions. In order to, you are all muted at this point, I think, and also to avoid background noise. But when you are ready to ask questions, we ask you to type in the chat that you have a question, and then our department manager, who is assisting us today, Elena, will unmute you so you can ask your question. So without further ado, Elliott, you want to?
Sure. Yeah. So thank you for inviting me. I'm unlike Shawn, I'm not an expert in global health. So what I offer you is sort of my analysis of what I could learn from afar of what's going on in Mexico and Cuba. And it's interesting. I'm glad we're having this panel because what you see is different types of states, different types of governments, and try to see how they have reacted to COVID is kind of illustrative more globally of how different states in Latin America act. So let me start with Mexico. I think everyone can agree Mexico's response was very slow to dealing with this. You have a relatively new president, López Obrador, who in January and February was not taking the virus very seriously. He was holding mass rallies, making a point of sort of hugging and kissing his supporters. And on March 22nd, by the time at which in the United States there were starting to be these lockdowns, López Obrador, the president, told people, his supporters, to live life as usual. He encouraged families to go out and eat in restaurants because it strengthens the economy. So all of this might seem reminiscent of our own president, Trump, who was kind of still slow to the uptake and kind of goes between urging caution and telling people to go out and buy stuff. So after that announcement on March 22nd, 2 days later, the government began to implement social distancing measures. At this point, however, the Mexican government has begun to give the green light to certain municipalities, about 300 of them, to open up, in spite of the fact that there's no testing available in many of those same municipalities. So I think to understand what's going on in Mexico, you need to understand it in the context of a health system which is, before the COVID crisis, already in crisis. Because for about a decade or more, there has been a disinvestment in healthcare. In 2019, 10,000 healthcare workers were laid off because of a 44% cut to the health and welfare agency. So you already have a system which it has been cut through a series of neoliberal and other kinds of reforms. And so now you're seeing that very same healthcare system tested. So where are we at today in terms of the numbers? And this is a whole question about whether we can trust any of these numbers. And I would say this isn't only true for Latin America. As we know, in the United States, for a long time, we were only getting the numbers of people who had actually confirmed tested positive, but many people dying in their houses who weren't being tested were not counted in those statistics. So as of today, there are about 71,000 cases confirmed in Mexico, and about 7,600 people have died. Most of those cases, or the big chunk of those cases, are from Mexico City, where you have a death rate of about 19 per 100,000 inhabitants, which is pretty high if you look globally at where death rates are. So since the beginning of April, the curve for new cases and deaths has been increasing. So there's been a lot of stories in the New York Times and elsewhere about this fear that not only is this sort of crisis that's about to explode, but that the numbers that the government has been giving don't fully tell the story. So the LA Times did a story where a reporter went to Ciudad Juarez across from El Paso and actually looked at 120 death certificates. 12 of those people were listed as having died from COVID. So those people would be the ones that entered into the official statistics. Another 63 people were listed as having died from probable COVID-related complications. And then in addition to that, another 30 or so died of pneumonia or other ailments related to COVID. So if you look at the official statistics, that is only counting those 12 people out of 120. So basically you have 93 people not being counted. So if we assume that those other people are actually COVID-related deaths and extrapolate that to the entire country, then what we have, the numbers look a lot worse for Mexico than what is publicly available. Okay, so if we look at testing, because a lot of people have talked about testing rates and testing as a way to deal with the pandemic, Mexico has among the lowest testing rates in all of Latin America, 1,200 tests per million. If you look comparatively to other places in Latin America, testing is 4 times higher in Peru and Chile. It's 7 times higher in El Salvador and 3 times higher in Brazil. And then in the United States, it's 27 times higher. So Mexico, even in comparison to Latin America and a poor country like El Salvador, really doesn't have much in the way of testing capacity. Okay, so moving from Mexico, which has, for those of you who don't know, López Obrador is kind of a leftist populist leader, but a weird kind of populist who likes fiscal austerity. Moving from Mexico to Cuba, Cuba is a leftist authoritarian government. And so one of the advantages of being an authoritarian government is that the government actually has the ability to issue orders and enforce them because they've got a lot of people willing to do that. They have a structure in place to do that. So on March 20th, with just 21 confirmed cases on the island, the government banned tourism and shut down all travel into and out of the country. My daughter was there on a college study abroad program and luckily got out before the borders closed. But that lockdown, now they've extended to July 1st. So this is a major decision for a country like Cuba, which depends heavily on tourism. To shut down tourism is basically like, you know, slitting their own throat in terms of the economy. But I think that they were very sort of ahead of the curve in saying, okay, we've got to stop this from breaking out. So the government has an order that if you go out into public, you have to wear a face mask. And according to the reports of everyone who I've talked to who's been there, people actually do. There are lots of police in Cuba who are enforcing this. Cuba also likes to turn these sort of global situations into propaganda campaigns. So one of the things that they've done, in addition to protecting their own people, is offer support for other countries. So they sent a brigade of doctors to Italy, for example, in the height of the pandemic in the Lombardy region. There was a cruise ship filled with British passengers who couldn't dock anywhere, and Cuba allowed them to dock and flew the passengers back to England. And so what Cuba has tried to position itself as, like, while the rest of the world is dilly-dallying and not issuing these orders, they're not only interested in protecting their own people, but in protecting the world. And I think that they've sort of gained a lot of respect around the world for those efforts. The other thing that Cuba has is a very deep network of healthcare workers who are medical students or nursing students. And I've heard from multiple people, including my daughter, who are in Cuba, that multiple times they've had people knock on their door. So these healthcare workers go to every residence, knock on the door, ask how people are doing, record their sort of health. If they're sick, they take them and get them healthcare, and I think also put them in quarantine. Those same people also, if they're older people, they will make arrangements to bring them food so they don't have to leave their apartments. So something like that is unimaginable in the United States. I mean, we don't have anywhere near that level of sort of government attention. The problem is that the same kind of conditions that we were talking about in Mexico with a failing health system, in Cuba, you had food shortages before this crisis. And so now what you have is people going out who need to go out to get food. There's, I think, a reduced supply of food. There's increased hoarding because of the hoarding mentality all over the world. So there are people who are having a hard time actually finding food when they go into the streets. In terms of rates of infection, by mid-April, Cuba basically is in the middle of Latin America in terms of rates of infection. If you compare Cuba to the Dominican Republic, which is an island close by and uses a similar protocol for testing, the rate of testing in Cuba is 6 times higher. So it seems that Cuba does have a handle on the situation. So far, there are only just under 2,000 cases, confirmed cases in the country, and only 82 deaths. So this seems like, looking at the curve, that since end of April, cases are declining, that Cuba really does have a good handle on this. But of course, all bets are off when they finally open up to tourism and people from Italy and Canada and the United States flood back in, and will likely bring back the virus with them. So I'll stop there.
Okay, thank you, Elliott. We'll follow up, I'm sure, with questions later on. Shawn, you want to tell us about the situation in Brazil?
Yeah, Brazil's been getting a lot of attention lately because it now has the second most cases in the world after only the United States. It's passed Russia. Yesterday was a sad day in that it actually reported more deaths than the United States did yesterday. It's averaging about 10 to 20,000 new cases each day. And the epidemic is accelerating. It's also a little bit unusual globally because so far about 15% of the people who've died have been under the age of 50, which is very different from what we saw earlier in the epidemic, say in places like Italy and other countries. And what's striking to me is I started the earlier part of my career in public health doing work with HIV and AIDS. And at that time, Brazil had such a deep sense of leadership around public health. For example, the new constitution that was promulgated after military rule in the 1980s said that healthcare was a public right, that everybody could go to a health clinic and receive care. And so, for example, with HIV and AIDS, medications were provided for free to anybody within reach of a public clinic. And Brazil has also had a long record in public health dealing with everything from malaria to Zika, where it has often handled major health challenges fairly well. That's not happening at all this time. I think that Brazil is a very polarized society right now, like many other countries that have a populist leader. But that the situation has not just been politicized, but there's also a growing loss of confidence in the government. And some of the issues involve state and local government. So, for example, the government of the state of Rio de Janeiro is being investigated by the federal police for corruption involving money that was designated for hospitals to treat people. There's multiple investigations in Brazil right now involving misappropriated funds for ventilators. So the deputy health secretary in Rio de Janeiro was arrested in a corruption scheme related to the purchase of 1,000 ventilators. So there's all these kinds of news stories appearing right now that are undermining public confidence. But the person who gets the most attention is definitely President Bolsonaro, who's a populist. From the very start, he's been very dismissive towards this particular virus as a threat. He calls it the little flu or the little cold. At campaign rallies, he'll reach out and shake hands with children. He's been promoting a drug, hydroxychloroquine, that has also received a lot of attention from President Trump in the United States. He's not someone who's really taken the lead in talking about the importance of social distancing, talking about the need for basic health care. And one challenge is that he has gone through 2 health ministers in the last month. The first health minister gave a TV interview in which he was critical of the government's response and resigned the next day. He was replaced. A new health minister came in. Last week, there were some rumors that the health minister was increasingly unhappy with President Bolsonaro's promotion of this malaria medication for treating COVID. The president said last Thursday that he wanted to see new guidelines issued to promote the use of this medicine. The next day, his health minister quit by social media post. He put out a WhatsApp message. WhatsApp is very popular in Brazil. He put it out from his office that he was leaving. That same, the next day, Friday, the government issued, the healthcare ministry issued new guidelines for using hydroxychloroquine. That same day, The Lancet came out with a major study, 6 different continents, huge study. I think it was more than 100 hospitals involved that showed that using the medication that the president was promoting, in fact, increased death rates in COVID-19 patients. And so I was just saying to Dr. Rodriguez before the start of the show that when I want to figure out what's happening in Brazil, there's a comedy program called Porta dos Fundos that gets a lot of attention. It's irreverent, it's bawdy. And 2 days ago, a friend sent me a link to an episode. And what it was a kind of comedy program about a series of health ministers quitting. And each of them would come in, they'd have their initial announcement, they'd say one thing wrong, they'd be gone, and you'd see the next health minister. And it's interesting to see how popular perception changes once people start to lose trust for the government. One thing that's been getting attention is that on the official government website, the reports COVID data, if you look at the font for the number of people who's recovered, it's larger than, say, the number of deaths and other negative information. So I think it's fair to say that at the moment, there's a loss of public confidence in the government, particularly the healthcare system is really suffering. People have not had enough personal protective equipment in the hospitals. There's been a shortage of masks. I think 116 nurses had died last time I saw. And so this has contributed to this atmosphere. Some of you may have seen just a couple of days ago, a federal judge also allowed a recording of a cabinet meeting from April, if I remember, to be released. And at that meeting, the Minister of the Environment said that they should take advantage of this moment to run more, change the rules about cattle production in the Amazon. And people were also shocked that the president was using profanity throughout this entire meeting to kind of refer to mostly mayors and state governors who he felt were taking advantage of COVID-19 to advance their political agenda. And so this has got a lot of attention in Brazil. And to sum up the current situation, the last I saw, 5 state governors had tested positive for COVID-19. There's a very serious situation in Sao Paulo where the Mayor Bruno Covas says that the city's healthcare system is in danger of collapse. I was just had an email this morning from somebody with family in Brazil, and her mother was just diagnosed with it, as well as her mother's husband, who's in the hospital. And so there's just this perception that the situation's quite serious, particularly in the Amazon, where they are now burying people in mass graves. And as bad as the situation is in the Amazon itself, what people are particularly concerned about right now is the indigenous populations, where there's very weak healthcare systems throughout the Amazon. So you see the virus spreading in the Rio Negro, you see it spreading in the upper Xingu. I think in the upper Xingu, there are 10 intensive care beds. There was a major dam built there, the Belo Monte Dam, some of you may have heard of. The government made a number of promises to improve healthcare in the region in exchange for people accepting the dam. That was not followed through on, so there's a great deal of press about this. So I think, to kind of summarize, that Brazil has failed to effectively and quickly implement public health measures that can control this outbreak, even though it succeeded with many other health challenges in the past. And I don't think that you can say that this is just a question of development, because you see countries like Vietnam and Thailand respond much more effectively, and other countries in Latin America also respond much more effectively. So I'm very worried for my friends and colleagues, and at this point, the data that's coming out of Brazil doesn't look very good at all.
All right, well, thank you, Shawn, for sharing. I'm sure, again, you'll have some questions and some other things that you can tell us about the situation in Brazil. So at this point, let me do my piece on Argentina. Essentially, Argentina has had quite a lot of initial success in containing the virus, although I would say over the last 10 to 15 days, things are not looking so good. The number of cases have accelerated. But Argentina had a first case relatively late. March 3rd was the first case detected in Argentina. And then as a few cases, there were 9 by March 7th, when the first death took place. And all of these cases, of course, were imported. They were people that had arrived from mostly Italy, but also Spain or France. They had been in Europe for vacation or for business. From then, they decided to act rather quickly. So by March 11th, there was a mandatory quarantine on everybody arriving from abroad, from any country. March 15th, they closed the borders to all international flights and also the land borders. And also schools were given or told not to, that they will be on schools were closed as well. That was March 15th. By March 20th, with 3 deaths and 158 cases, a national lockdown was declared. So very quickly, I mean, Argentina had cases in a span of 17 days, essentially. The country went from having no cases to a lockdown. But it's particularly interesting is that it's a very strict lockdown. Because you can see the lockdown in the United States, as different states imposed lockdowns. It was not centralized. It was no federal level. It was at the state level. And Argentina was declared. A couple of provinces actually declared it before the 20th. I think as early as the 16th. But the national lockdown was extremely strict. It requires people. The only things that could stay open, the only businesses that would stay open initially, that stayed open were those related to, government would stay open, food production would stay open and processing, and health and basic needs products that have to do with household hygiene. Those would be the only businesses that were allowed to remain open. People would have to, there was transit control. You couldn't drive your car unless you had acquired a special permit to do so. And you would only get it if you were working in one of those industries that remained open. Public transportation remained open, but you only could use it if you actually were working in one of those sectors. If you were stopped, the police was mobilized to different transit hubs and places and streets and places of transit. And if you were stopped without a permit, you could be you would be given a warning, but some people would get actually would be taken into custody. As of sometime last week, I don't remember exactly the date, but about a week ago, 8.5 million people had been given a warning in Argentina for violating the lockdown, and actually 85,000 had been detained. In other words, they had been taken at least temporarily to prison, or they had been held for some time without allowed to go to their homes. 4,500 cars had been taken by the police. So it's a significant crackdown on the lockdown. Was very strict and strictly enforced, not just strict in terms of how you could do things. Now you may ask yourself, well, how did people go to buy food if there's not driving? Well, that's one of the secrets. In Latin America, you have all these smaller markets. You don't have to go to the supermarket by car and so on. So things that perhaps are not possible in other countries, but are possible at least in Argentina and probably many other countries. So it was very strict, and I think that's why, to a large extent, it was quite successful initially. This was because the virus started to spread with imported by people who had been in Europe. The situation was such that that it affected mostly well-off neighborhoods in Buenos Aires and around Buenos Aires. Sometimes there was one case actually of a man that returned from France, I believe, and he was from Resistencia in Chaco, which is a poor neighborhood in northeastern Argentina. That's the only case that initially was outside the world. There's a case in Ushuaia, also probably from tourists with in the cruise ships. But the cases outside of Buenos Aires were very few, and mostly the cases were among those people that had the capacity to travel. So it was mostly in the well-off neighborhoods of northern Capital, northern Buenos Aires, the city, and in the areas of Vicente Lopez and San Isidro, and in the sort of like wealthier suburbs outside of the city. And so the lockdown actually allowed for much of it to be contained in those areas initially. However, as things developed, the expansion rate actually, because the strictness of the lockdown was such, the rate of doubling of the cases was diminished. And I have a graph later I can share with you. But about 3 weeks, 2 or 3 weeks ago, and this was the biggest fear of the government, they started detecting cases in the poor neighborhoods of Buenos Aires. What we normally would call, these are neighborhoods that we normally call slums, right? Villas in Argentina, villas miserias. They're neighborhoods that do not have proper sanitation, do not have proper streets. They have some basic health services that the state has started to provide in some of them. There's one in particular, the Villa 31, is 10 blocks from downtown Buenos Aires, basically. It was built on the old railroad land in downtown Buenos Aires. And it has buildings that go up to 3 and 4 floors. So it's a slum, but it's already sort of like have these tall buildings. And there, in 50 meters, you can have 6, 8, 7, 8 people living together, right? And so under those conditions, of course, the virus spreads very, very easily and very fast. And the government started detecting people with the virus, and then as they started looking deeper, they focused some of their testing efforts in some of these neighborhoods, and so the number of cases has increased significantly as the testing moved into these neighborhoods. Now, of course, you may ask, well, how did the virus get to those neighborhoods? It's hard to tell exactly how that happened, but most likely through people having to go to work and being in contact with other people from wealthier neighborhoods at work as they conducting their business. And so now that is the biggest challenge: how to stop the virus from spreading in the very poor neighborhoods of Buenos Aires. Now, an interesting statistic is that the Buenos Aires metropolitan area, which is the city of Buenos Aires plus the surrounding urban area, has 90% of the cases in Argentina. So it's highly concentrated, which I think is quite significant. I mean, most countries, you see a lot of the cases in the large cities, obviously, but the concentration here is extreme. It's true that about a third of the population of Argentina lives in the metropolitan area of Buenos Aires. But here we're talking about 90% of the cases concentrated there. In fact, in the last 14 days, 84% of the counties of Argentina have not seen new cases. So it's really an amazing concentration of which means my sense is that the authorities are able to contain it. As long as they contain, they keep a strict lockdown in Buenos Aires and the surrounding areas, they can probably loosen up a lot of the rest of the country, which is something that they have been doing. Slowly, they have been loosening up the lockdown in other places, but they keep it a little more strict or significantly more strict in Buenos Aires and the conurbano, the areas surrounding Buenos Aires. Now, how is it that they were able to enforce, besides enforcing through police, to the police, what else, how else is it that people are not, what are the economic measures that they put in place to support people? Well, they put a number of things. They actually froze layoffs. They made layoffs illegal, but gave subsidies to firms and tax breaks to firms to continue paying salaries. Of course, this doesn't include the informal sector. That's formal employment, and there's a large, sizable informal sector. For informal sector employees, they did transfer payments, small, obviously nothing too large. Argentina, as many of you may know, government in Argentina just had taken, the new president was elected in November and had taken office in December. So it's a fresh government with less than 3 months in office by the time the outbreak gets started. The government had inherited from the previous government an enormous debt that had been accumulated in a very brief period of 4 years. And the government was already talking about negotiations, was already starting negotiations to avoid a default before the pandemic hit. So the government is very strapped for money. despite this, has implemented a very significant package of tax breaks, subsidies, transfer payments, reduction in payroll taxes. Right? What is going to be the outcome of this in terms of the economy in the future? Who knows? It's very clear that the economy is contracting, has contracted as a result of the strict lockdown. But it has taken many measures to defend, make sure, for example, no cutoffs of utilities, electricity and water cannot be cut off. They are trying to do some spending, they increase health spending, and they actually, one thing that they, having few dollars, given the situation with the debt, they actually, one of the first things they did is they put Argentine scientists to look for ways to test for the virus with local inputs, so they wouldn't have to rely on external inputs for containing the crisis, and so the health sector received a boost in terms of spending as well. So those are some of the measures that were taken economically. Now, in terms of politics, the politics in the country, country has been very, very divided. The new president was the chief of staff of Cristina Fernandez de Kirchner, who was in the country ruled the country for 2 periods, 8 years, from 2007 to 2014. And there was after her came, and she was what you would consider her left-wing populist, right? Center-left, I would say. After her became a very neoliberal sort of president, Mauricio Macri for 4 years, which is the one that created a very large debt in that period. And Alberto Fernandez, who is the president who took office in December, has as his vice president Cristina Fernandez de Kirchner, and he's associated with sort of like left-wing, center left-wing, and some people would accuse him of populism, although that is not so clear yet. He's more of a moderate, definitely, than Cristina Fernandez de Kirchner. Oh, they're not related, by the way. Fernandez is just happens to be a common name. So he actually saw his measures, these strict measures, which you would think, well, being so strict, this is going to be a disaster politically, and being, well, perhaps it helped him that he was new in the office. But his popularity rose initially because it was such a determined response, such a quick and determined response. His popularity rose very quickly as the lockdown bore on and things, people started feeling a little uncomfortable with the strictness and with their economy suffering, with their income suffering. The opposition has risen. That there have been some hardliners on the opposition party that were starting to steer things and organize some clacking of pots and pots as a sign of protest. But now also the media, the mainstream media, which is the Grupo Clarín and La Nación, the largest 2 newspapers in Argentina, they have also started to stir things up, including one photograph from protest in, I don't remember where, I think maybe Chile, against the lockdown, and they published them as if they were in Argentina. So, and then they had to apologize because somebody noticed it and they were told. But there has been a rising discomfort with the lockdown. And so it's likely that the political pressure will keep mounting until some of these measures have to be undermined. It is also clear that now the virus is more of a threat in those poorer neighborhoods. So my sense is that some of the upper middle class sectors of society who tend to be opposed to the current government are feeling less of a threat in respect to the virus, and don't see it as such a necessity to continue a strict lockdown. So we'll see how things develop. All right. Any questions? Rather, I'm sure there are questions. So if you have one, please type into your chat that you have a question, and then we'll have you unmuted. Maybe I'll start with a question for discussion. Elliott and Shawn, do you see? I mean, I think Elliott addressed these, but I wanted to ask Shawn also on Brazil. Elliott mentioned, Cuba and the authoritarian regime there. So it's a very unified, sort of like you can just take action, right? Brazil is known for being quite a federalist republic. Does that have anything to do with this, or is it really more to do with Bolsonaro himself?
I think you're definitely right. Brazil is a federalist republic, and the state governors have a great deal of influence. It's part of the reason that I think Bolsonaro has been so angry is that he wants to have more authority, but has had trouble exercising it. So that's definitely definitely defining Brazil's response so far. It's been very fractured.
Okay. And Elliott, do you see anything in Mexico that?
In terms of, I mean, Mexico also, has a centralist state, but also has, well, there's a history of sort of struggles between federalism and centralism in Mexico. I think the response has tended to, in Mexico, has been organized from the federal government, but it's been for a long time so weak in actually implementing it. And I think part of it is a recognition that, because so many people are in the informal sector and so many poor people need to sort of go out to earn a living on a daily basis, that having a strict lockdown would be kind of like a death sentence for many people. So I think that they also have to, like in each of these countries, deal with the realities that are there. I just talked to someone in Zumpango in the state of Guerrero in Mexico, who I run a conference in Tepoztlan outside of Mexico City every summer, and his family usually cooks. So I was calling him to let him know we're not doing the conference, but he moved to his home town basically to collect firewood in the countryside as a way to make money. So people are desperate. And I asked him, is the government doing anything for you? He's like, the government doesn't do anything for us. So I think people really are left on their own to fend for themselves.
Well, that raises a question for me. An interesting question seems to be, I mean, Argentina has also a number of people in difficult situations, and they are not, I mean, they're in difficult situations, meaning that in the informal sector without an income. Part of the answer could be that just the level of inequality in Mexico is higher, or at least traditionally has been higher than Argentina, but Argentina has that situation. To me, the question raises is, does it have anything to do with AMLO's, with López Obrador's fiscal austerity? Because one of the things that precisely Alberto Fernandez has done is say, okay, we'll put a lot of money out there. We'll do a lot of fiscal expenditure, so people in the informal sector and people that will end up unemployed or prevent from being employed will put fiscal resources and credit, so even monetary resources, to make sure that doesn't happen. So in other words, I'm wondering if the leaders themselves in power and their predilections or fears. I mean, AMLO is supposed to be also a left-leaning leader in Mexico, but some people are questioning that precisely because of the lack of his adherence to fiscal austerity. So, and perhaps you can tell us about that in Brazil as well, Shawn.
I also noticed there's a question from Kimberly Brown,
Oh yeah,
if you want to take that.
yeah. Kim, you want to ask?
Actually, I just wanted to say there are a few people before Kim who have questions. So let me go ahead and ask Liliana Diaz to ask hers.
Hi, can you hear me?
Yes.
Yes.
Hi, thank you. So I had kind of a related question to what you were just discussing. So my family's from Colombia, so I've been watching the news of the coronavirus coverage that's happening down there. And so right now, the president had put on like a strict lock-in. No one's supposed to be working, no one's supposed to be going out. And they have been kind of backing down on those restrictions recently because a lot of people have been protesting because a lot of people have lost their jobs because of that. And in Colombia, there's not like a really robust unemployment benefit system. And so people are left without any kind of food, any kind of water, no way to support themselves and their families. And so the president has kind of, opened back up factories. He's opened up some other businesses in order to address that. And the concern is that, of course, the problem hasn't been contained enough. So the concern is that the coronavirus is going to continue to spread because of that. But I wonder how that's kind of come into play in other countries where, you're locking down these industries and these people locking down these industries and having people stay at home, but without any kind of support to get these people, like food and some sort of income to support their family, how that's kind of come into play.
Shawn, Elliott?
Well, maybe I'll just say a little bit about Brazil. I mean, this is definitely the question that is dividing the country, is how do you at the same time respond to the virus and yet still keep economic activity happening? And what we've seen, there have been countries, for example, in Asia, like Vietnam and Thailand, that were very, very successful with testing and tracing early on. And in the Western Hemisphere, countries were too far behind. And by the time that people realized the capacity needed, it was too late. And so we're sort of in this no-win situation where there's this intense pressure to open because of the economic need, particularly amongst the poor in the informal sector. At the same time, if we do that, we simply don't have the structures in place. And this is such a huge pressure. I was talking to someone that I knew in Brazil 15 years ago who had opened up a daycare center that closed, I want to say around March 16th, and it hasn't been open. It's extremely difficult. And of course, all those people have been without income for 2 months now. And so I think this is part of the factor that's driving this polarization, is this sense of economic need. And I think it is a situation in which countries like, say, Uruguay, that perhaps has a better social safety net, is much better prepared. But Elliott, what would you say about Mexico in that context?
Yeah, I mean, I think kind of all over the globe, it's the same debate about how, the balancing protecting health versus the getting the economy going, and in places where where there are high rates of poverty, it's a matter of like people eating or not eating. So I think that's been true in Mexico as well. I mean, the way that, if you think about the United States, the way not that we've solved the problem, but they just hit the button and printed up lots of money, right? Which is, of course, exactly the advice they tell Latin America not to do. Like, when you're having an economic crisis, don't spend money, austerity. But when a crisis comes to the United States, the first thing they do is like billions and billions, trillions of dollars, like spread them out because, you don't want people to suffer. And also it's an economic strategy to keep people going until hopefully the economy gets restarted. So I think the longer this drags on, there's going to be more and more pressure to open up in certain places. And I think in Latin America, like you were saying, Shawn, there just isn't the testing capacity. So a second wave could come and really it'd be much worse than the first wave.
Yeah, I want to answer Liliana's question along the lines of what I was asking earlier. Actually, I think the this division between keeping the economy going and having public health or keeping the pandemic from spreading, the virus from spreading and causing damage to public health. There's almost like a false dichotomy, I would say, between health and the economy. These are not two separate things, I would say. You can have a healthy economy if you have the pandemic just running. The people will be afraid to go on the street and consume and go to work, right? Although we know that for 20% of the people, it's not apparently so terrible. We also know that once it gets going, if the sanitary capacities and the capacity of any country get totally overburdened, as it happened in New York, with people being buried without without boxes and so on. I mean, just outrunning, the corpses being in U-Haul cars and so on. So you can't just let the virus run rampant because of the economy. You can't political either. But I think one of the things that governments can do is precisely take this example of this is a crisis, a situation, it's an emergency situation. And just as Elliott pointed out, the United States starts printing money. That's one thing you can do. Well, it's not only the capacity of the United States to print money. Nations that have sovereign currency can do the same as long as they control the flow of dollars in. There's going to be inflation, there's going to be a disruption of the economy, but you're seeing life in the meanwhile. I think you can have much larger levels of deficit. You can have spending that tries to reach those sectors of the population that are in the informal economy or that may end up in unemployed. Through social programs and transfer programs. I mean, this has been done when there's been crises in the past. Usually there are crises of an economic nature, but if you have a public health crisis, that probably needs the same sort of tools and interventions from the state. It's just that, neoliberalism tells us we cannot do it. But, here we're talking about lives. So it probably needs to be done. Anyway.
Okay, we have a next question. It will be from Marlon Fernandez.
Hi there, thanks. It strikes me how different the response has been, in particular between Brazil and Argentina, but still leading to political divisions in both, especially in Brazil. So my question is, what have you seen so far, and how do you see in the future the impact of COVID-19 on regional relations? My sense is that already with the populist tendencies of Bolsonaro, there's already been some friction in the region, but I imagine that's exacerbated by COVID-19. I'm just wondering what your take is on that.
Yeah, I think that's a really good point. I would say it's too early to tell yet, but right now, Brazil's about half the population of South America. And I think neighboring countries are very concerned about what's happening. What's very interesting is that even though Trump and Bolsonaro in many ways are political allies, Trump, I believe yesterday, limited the travel rights of Brazilians into the United States.
Yeah,
and so I think a lot of neighboring countries right now are wondering, well, how do we manage this? And if the numbers continue to increase at the rate that they are in Brazil, how do we deal with that? And then also all kinds of different economic and political questions that start to arise from that. So we haven't seen too much of that. Nations are being very focused on internal affairs, but I think that's a really good point that there will be increasing pressure, particularly around travel rights.
Mm-hmm. Thank you.
Yeah, I would address that saying that, as you point out, there's tension between Bolsonaro and this is the case of Argentina, because, well, ideology, right? Although both presidents could be said to have populism. One is associated with the right wing. Bolsonaro close to the military and has justified even the coup and the military regime that was there 64 until 83. Alberto Fernandez is the exact opposite, backed up and supportive of human rights movements in Argentina that have actually put a lot of the military in Argentina, former military regime presidents and dignitaries in jail even. So if you look at it from just the ideology, Bolsonaro actually, before Alberto Fernandez got elected, was talking about how it would be ridiculous for him to be elected. I mean, there's all this tension that was taking place before the COVID. In fact, the poor handling by Bolsonaro and the Brazilian government of the pandemic makes Alberto Fernandez looks really good, because he basically is able to contain things. Now, that said, if the economic situation gets much worse in Argentina, that's not going to help. That's not going to have much of an effect, having Bolsonaro as the bad guy. But I don't know about the rest of the countries. A lot of countries depend heavily on trade with Brazil, including Argentina. And the association, the economic association, Mercosur, was already under a lot of strain. So this certainly is not going to help. But I think more than Argentina, Brazil, or Brazil and other neighboring countries, this has to do with countries are going to really reassess how they integrate to the rest of the world, because they're going to be thinking more in terms, how do we deal with something that essentially requires strong states to be somewhat self-reliant. I mean, the fact that masks were being bought at airports that were going to one place and then they were kidnapped by other people in the airports to go to another place, that just gives you a sense that the international order doesn't work so well under these situations of public health crisis, at least not this time around.
Okay, our next question is from Catherine Gomez.
All right. Hello, everyone. My name is Catherine Gomez. I am a junior. I belong to the social work program. I'm really glad I ended up here. So thank you for the people that put this together. And also thank you, Elena, for facilitating. So I am originally from Colombia, and I am a little bit concerned with the situation in Venezuela. And also, I would like to know a little bit about it. Kind of like what Elliott was telling us, that Brazil is the second in the rank of countries with the most people infected. So with the neighboring countries, as we know, Venezuela, many people immigrating. So what is that threat, for South America specifically? Because we know Venezuela has the healthcare is crumbling apart. There is no medicine, there's no sanitary conditions, there is water shortage. And looking at the data coming from Venezuela, there is a lot of people infected, but only 10 deaths. That doesn't make sense to me. So my question more or less is are they underreporting data? Because I feel like the cases, I don't know. I just wanted to know your opinion. I'm sorry.
Yeah, I mean, in Venezuela, I think probably we could say that almost every country on the planet is underreporting data at one time or another. I would be suspicious of all data, including from Venezuela. That being said, I think that Venezuela has the weird fortune of kind of being pretty isolated before the outbreak of the virus. Already there are very few flights going to Venezuela from the United States and from the rest of the world because of their economic crisis, and they weren't, the fact they weren't paying people. So I think because of that, Venezuela might be saved if we could believe the numbers. Of course, given the economic devastation, the crisis in the healthcare system in Venezuela, if it if it did break out in Venezuela, it would be an absolute disaster. And so I think that would be the fear. And then, of course, being in Colombia, a lot of people from Venezuela, the easiest place to get to is next door, going to Colombia. So that would, if you have migrants who are bringing the virus with them, that would be a threat or possible threat to Colombia. Shawn, I don't know what you would say about Venezuela and Brazil.
I would say exactly the same thing that you did. I mean, there has been a lot of migration from, not as much as into Colombia, but into Brazil as well, particularly in the Amazon region. One thing I would say, sort of stepping back, is that we see right now some countries doing better or not, depending in part on how early they shut down, and how early that shutdown happened is having a really big impact on this sort of first wave of the epidemic. Now, we don't know what's going to happen, but if you look in 1918, the last great pandemic, there were 3 waves. There was one in the spring before, which was not as bad. Sort of the following October through January, it was very bad. And then in the following year, 1919, there was one as well. And so what's hard is we can't know what's going to happen. We can't know if and when a vaccine is going to come. There's so much uncertainty, but it is quite plausible to think that we're going to see another wave sometime, next winter. And so that what I think is going to be very difficult is that for some countries that have kind of been able to lock down early and have missed or have been more successful during the first wave, are they going to be able to get the systems into place, the contact tracing, the testing, and other measures in place? And so my fear for Venezuela is that if you look at sort of the longer term, it's going to be very challenging for them. You can't completely shut down any border forever.
Okay, so we have another question from Regina Navarro Gomez.
Hi, it's good to see some of the professors here. My question was related to, I read a New York Times article about cartels' response to COVID. I know that Professor Smallman, you teach a class related to this, to the war on drugs. My family lives actually about 30 minutes from Tepoztlan. So that's related, and Morelos is actually very, there's a lot of drug wars in that area. So I'm not sure if you guys could provide a little bit more information of how you think the cartel's response has been to COVID.
Yeah, that's an interesting question. I mean, one thing I would say in talking to someone from Tepoztlan today is they have retenes, or basically they've barricaded the town. So if you're not from there, they're not allowing you in at all. And of course, Tepoztlan received a lot of tourism from Mexico City. And so I think they're trying to protect the town from the virus entering that way. In terms of the cartels, I think that it's interesting that the cartels have responded almost like a governmental response. Chapo Guzman's daughter was out on the streets passing out little boxes of supplies to people with label on the box like "from Chapo Guzman." So I think the cartels, already act as quasi-governments, providing employment and social services to a lot of people. And I think that that might be anecdotal. I don't know the extent to which they are actually trying to help protect people or provide those supplies. But in so many parts of Mexico, the cartels really have a more effective presence than the government. So they would be the obvious entity to step in and provide resources. Also, they do have money, so they can do that. I'm not sure what the effect has been on the murder rate, although I would assume that, with everyone sort of all activities being diminished, it would be a decline in the violence associated with the drug war, but I haven't seen any data on that.
Does anyone else want to say anything about that, or can we move on to the next question? Okay. So the next question will be from Maria Vasquez, and she wrote, she's asking you to talk about the role of the fake news in the current COVID crisis.
Who wants to take it first?
I'll say just a little bit. You know, it's amazing the power of fake news. And it's hard when information is happening so quickly. And one of the things that's been interesting to me for a long time have been conspiracy theories. So for example, I wrote about conspiracies theories with H1N1, and then I wrote about the conspiracy theories that were told about Zika in Latin America. And I'm actually giving a talk tomorrow about conspiracy theories and COVID-19 in a class at PCC. And what's interesting to me is how much recycling there is, but also how people tend to point the fingers at the same particular individuals. And if you kind of take a look at the usual suspects, there's a lot of mistrust of pharmaceutical companies, which is something you've seen for a long time. Bill Gates, that man has received no credit whatsoever for his philanthropy. You know, people target him. So there's a lot of fake news. There's a lot of conspiracy theories. Some of them they're in Europe as well. This isn't something particular to Latin America. Some of you may have read in the New York Times how there's a conspiracy theory circulating on Facebook and social media that the virus is being promoted by new 5G networks and that the radiation from these networks undermine your immune system. So there have been over 30 cell phone towers burned down in the United Kingdom, which is simply unbelievable. But you know, I'm talking more maybe about conspiracy theories than about fake news. But one thing that I would say is this is really serious because if people listen to fake news, it changes their behavior, and people's behavior impacts the spread of the virus. And so for me, one of the things that I'm very worried about is, say, fake news coverage about vaccines. There's already an anti-vax movement which is starting to organize. If you spend any time on social media, you know that. I spend way too much time on Twitter trying to argue with people, which is probably not productive. But I do think, okay, can we get the vaccine? How quickly can we get it and really roll it out? But then how do we deal with the stories that are told? And obviously people aren't only influenced by mainstream media. They're also getting news from YouTube and all kinds of other. WhatsApp is huge in Brazil. It was very important during the Zika pandemic. And so this is one of the real challenges right now with the proliferation of different kinds of ways to get information. How do you give people information that they can trust? And I certainly don't have any answer to that. And Polo or Elliott, I don't know if you want to add anything to that.
Well, I mean, just thinking about how Mexico has been reported in the United States, the New York Times came out with a story a few weeks ago, which was very critical of López Obrador and the Mexican government, and made all sorts of claims that then, you know, people within Mexico and Mexicanists like said this is not based on any reality, and the government has actually been more proactive, you know, since that initial period of denying there was an issue. So I think even in the respected, you know, Trump calls New York Times fake news, but New York Times, I think most of us think of as a respected news source. It becomes a time when tropes about Latin America as being disorderly, chaotic, not being able to govern themselves, get sort of remanufactured in the news. And so I think it's important to, even in the respected news sources, to think about what those are based on, like who's being cited in those reports, and also to think about how it compares to the response in the United States, which just seems to be utterly chaotic and, you know, like among the worst examples, if not the worst example in the entire world.
Yeah, that's a very good question. The role of fake news, as Shawn pointed out, is it has an enormous impact, it seems, at least in certain sectors of the population. And it really mobilizes people politically, oftentimes in ways that are not desirable, precisely because they're fake. In the case of Argentina that I'm most familiar with, because there has been this deep division that arises from the opposition to sort of like left-wing populism that existed, the Kirchner the Kirchner and the anti-Kirchneristas, they call it La Grieta in Spanish. Because of that, social media, fake news have been rampantly used in there. And as I said, the mainstream media in Argentina is actually very much on one side, right? They felt threatened by the Kirchner governments when Cristina Fernandez de Kirchner was in office, and still feels threatened now as she's vice president, and the president obviously is close to her. I think it's a huge problem, but there's really no way of. I have no idea how you address the issue of fake news in Latin America or anywhere really for that case. It's a problem, and at least in the Argentinian case, it's used for political purposes mostly. I mean, or at least those are the ones that worry me the most. At least I haven't seen it so much. There may be anti-vaxxers and so on, but I don't think those are so terribly large and influential as the fake news that are used very specifically to undermine the particular figures, right, of the opposition or of the officials in the government.
Okay, I have one more question from Liz Falkman, and it says, with the U.S. threatening to sever ties with WHO and stepping down from a leadership role in global health, how might that impact our southern neighbors? And what kind of message does that send, which might affect our future relationship with these countries who are vulnerable to this pandemic?
Shawn, do you want to say something?
Yeah, my feeling about the World Health Organization, for all of its flaws, I think the World Health Organization is like the UN in that everybody loves to disparage it and say that it's ineffectual until they need it during the crisis. And then there's sort of no substitute for it. So there's a lot of problems with the World Health Organization that reflect how it was created and reflect a structure of international relations with power inequalities and other issues. Those aren't going to go away. But in the end, only the World Health Organization can do certain key tasks. If you want to look at questions like polio eradication, there's other major actors, but nobody can take the place of the WHO. And so I'm not sure what's going to really happen. We've all probably heard that if I remember correctly, President Trump has issued a letter that says the World Health Organization has 30 days to say how it's going to reorganize or he will cut funding. I think he did that the same week that China announced an extra $2 billion of funding. I might have the details off, but there's no question that the world needs the World Health Organization. And my concern is that anything that sort of just detracts from sort of the basics is undermining the general response, and that it will have a disproportionate effect on countries that may not have the same resources as, say, the United States. There's more I could say, but I think I'll stop there. Thanks. It's a great question.
Yeah, I mean, I would just add that I think this is about sort of Trump's retrenchment in one way from the international stage, and that leaves space for other actors like China, Russia to play a leadership role. And that was already going on in Latin America with China's increasing investments there. And I think to the extent that the United States does retrench and retract, other people will, or other actors will fill that void. And, you know, but the United States, I mean, it's hard to see the United States as not having a disproportionate role in Latin America just because of the trading ties, which don't seem to be going anywhere anytime soon.
And do we have other questions, Elena?
I haven't received any requests for a question so far. If you want to give it another minute or so.
Okay.
Well, I'll just note that in the chat, Maria Teresa noted that drug violence has been increasing dramatically. So that's something to be aware of. And then Gustavo mentioned that the CCP has a better opportunity to take a leadership role economically. So I think those comments sort of bear on our conversation as well.
Thank you.
Very good.
Well, one thing, let me ask the two of you, how do you think this is going to affect migration trends from Latin America, and principally Mexico and the Northern Triangle countries in Central America?
Well, I would just say that I don't have any good information on what's happening right now, but I would assume that it would be less attractive to move to the United States and kind of go through that difficult journey at a time of such great uncertainty, because, you know, the pull to the United States obviously is jobs, and yet we're entering a very serious economic situation here, made much better by the investments that we've talked about. So what I would assume that for the short term that would fall, but I haven't seen anything about that. So I'd be curious to hear if either of you know more.
Well, I sure haven't heard anything about having the repercussions on migration at all. In the very short term, at least, many countries have closed their borders, but you're asking specifically entry into the United States, Elliott. So I don't really know. I would imagine, though, counterposing Shawn's, I agree with Shawn that you would think it would be less attractive with fewer jobs and a tanking economy here. At the same time, there's probably there's going to be a tanking economy and fewer jobs in Mexico. So there's also that other aspect of whether people may not be forced to look for opportunities that are less and less available, but still may require them to move. But I don't know. Just
and in terms of the border policies, I think they've basically said they're not going to be taking new asylum cases. So they're pushing, you know, that remain in Mexico now is becoming remain in Mexico for a very long time. Also because the immigration courts, unless you're detained already, they're not hearing cases. And so those people are just piling up if they've come to the border in Mexico. I don't know if that's enough of a deterrent to stop people from migrating, because the situation in Central America is, in the Northern Triangle countries, you know, it's not only economic, it's also the violence of the drug cartels and gangs is so extreme that forces people out. But yeah, I don't know if at what point that creates a deterrent if they actually, you know, can't get into the United States because they've shut off that border.
Maria Teresa has written onto the chat that migration continues and the role of human traffickers continues. They just happen to be charging more. And then M tells us, but the US, oh, I think that's on a different chat, different thing. There are reports from the Mexican side camps that they are overwhelmed with COVID cases. Liliana Brock is telling us that. Actually, well, that was going to be a question I was going to pose for you, Elliott. If you knew anything, what was happening with the camps of Central American migrants at the border. Liliana's telling us that they're overrun by the situation.
Yeah, I mean, I've heard about cases of COVID, and anytime, like in prisons, you have people together in unsanitary conditions. It's ripe for the spread of the virus. But the other way that the United States is participating in the spread of the virus is through deportation. So a very high proportion of the people who are being deported on these flights to Central America have tested positive for COVID. So kind of like the way in which the gang problems which originated in Los Angeles and then through deportation were sent to Central America. Now COVID is being exported to Central America.
Right. Okay.
I think that Gustavo Angel wanted to say something.
Hello? Let me see if I can. Hello?
Yeah, we can hear you.
Oh, okay. There is. All right. So I'm the recent graduate from the International Development. I guess my question is pretty much in the long term. From my research, I realized that the Americas, the United States, Canada, Mexico, and a lot of Southern America have been hit the hardest during this pandemic. As a recent graduate, I've been finding it difficult to kind of try to look for jobs internationally and currently here. I guess it seems that how do I put this? Like a lot, like you guys mentioned medical and economics, and I've kind of started to realize the disparities apparently in the US, but more so in a lot of parts in Latin America, in the sense of, I believe someone mentioned earlier about Venezuela and parts of like Brazil and Venezuela. I believe there's like other countries that have experienced a lot more hardship I would say this is probably like just in politics or just government policies of how they've been handling it compared to the counterpart in a lot of parts in like Asia, which have actually rebounded, which kind of led to my answer before when I kind of deep dived into this whole conspiracy theory of China and the CIA and whatnot. But essentially, I guess economically, do you see like this global pandemic really pausing the global economic system and seeing a shift to something a lot more, I don't want to say like socially or like Marxism, but like you can see how the fault in healthcare, not only in the US, but a lot of Latin American countries, has kind of been exposed compared to like a lot of Asian countries and kind of just like more European countries that have a more socialist, Marxist kind of mentality in how they govern themselves. From what I understood, do you see that the US and parts of Latin America are going to be shifting more to the opposition of like better universal care for just its citizens?
I'll take a stab at your question, first shot at least. I mean, crisis is a severe crisis, right? Global crisis. All crises always are moments of opportunity. It's always in this sort of crisis, be they are economic or not, that things get reconfigured. And they get reconfigured according to whoever can move forward their proposals to deal with particular issues and how people perceive those proposals to be, and sometimes it's people when it's more democratic, and sometimes it's just particular individuals when it's less democratic. But things are likely to change, to shift, in my opinion. I don't think it's going to be everywhere the same sort of shift and the same magnitude, but I do believe that people are going to start seeing investments, at least investments into some sectors of public health. The state intervening in some things are going to be seen as much less noxious. That's sort of like going to be the more widespread sentiment, I would say, which doesn't mean that it's going to change actually things in places of power, unless we have, you know, true representation and democratic government. But I think people will perceive, and so the change may take a long time to manifest itself. But I think people's perceptions of the role of the state, which has been driven by, you know, the idea of neoliberal idea of, you know, the less involved, the less engaged it is, the better. I think that's been questioned by this crisis. At the same time, people right now in power are trying to make sure that there's no that sort of shift, and that all sorts of regulations protecting the environment and protecting labor and so on are being undermined, and wealth and power are being concentrated. I mean, all you need to do is read the paper and some of the policies being passed by the Trump administration to see that in play, right? So what's going to be the outcome is hard to tell, but I think in the long term, people will reconsider the neoliberal mandate of retaining small states, small but relatively authoritarian states oftentimes.
I would also note that this weirdness where we have a healthcare system now, which in which people are being laid off simply because the elective surgeries is where they make a lot of the money, and so because those have been canceled, then hospitals are having to lay people off. So I think that sort of shows that the healthcare system is functioning not on the basis of need for healthcare, but on the basis of like this capitalist basis of need to make money. And I hope that people see that and maybe think, oh, well, we need a different basis for establishing healthcare. But if you look at what has been happening with the stock market versus what's happening with the economy, you could see that the stock market has rebounded, and investors seem very excited about this moment, which should worry us, because with 40 million people out of work, why are they so excited? I think that they're excited because this provides businesses actually with a time to restructure, take back things from workers. You could think about what's going on in universities, what's likely to happen in universities. So, you know, it'll be a struggle on both sides, and it's unclear. But I don't think capitalists in general in the United States or around the world, I think they see this as a moment of opportunity, and are lots of people have made, or a few people have made lots of money off of this.
Well, it is 1 minute, so maybe we can take one last question. And I see Liliana. I don't know if you're managing the queue, Elena. Is Liliana?
Well, yeah. People have sort of been having a discussion on the chat. So okay. If I'm not sure who would be next at this point, because they've been answering each other and corresponding. But if anyone would like to, let me know and I'll unmute you.
I think Liliana has...
Oh, Liliana. Okay, yeah. Just a second.
Mm-hmm.
Hi, everyone. So I guess my question is more on the long term. Where the civil liberties are going to fit, especially whenever we started to think that they kind of add a vanity when we have a health crisis. And on the other side, we have like being afraid of being associated to being a right wing. So it almost seems that there is ultimately not room for thinking about this, especially whenever we have crises. We know that this is the perfect opportunity for, governments to basically restrict these very liberties that we have, and we are a lot more willing to give them. But I question it, how can we even exercise this when we constantly have TV telling us that basically right now that is not a priority, when I think that we should be watching what is happening in regard to our civil liberties.
Yeah, maybe I could just say a couple words about this, because this is This is a good question, and this is the struggle that's at the heart of the public health response with every pandemic. I mean, these debates that we're having in our country about masks and all kinds of other restrictions are nothing new. You saw them in 1918, 1919, and there's all kinds of different responses to that. What I would say is that you said that we're more willing to accept them, and I think in general most people are. And I think that what's interesting is something that Dr. Rodriguez said, which is that right now these very difficult measures that have been taken in Argentina are both painful and brought some popularity to the president. I think that people are willing to make sacrifices. You certainly see something in Brazil and the United States that's, I think, pretty different than many other countries where there is this greater backlash towards some of these restrictions. My question is, how quickly can we get, it comes back again to contact tracing and testing. How quickly can we get back to that so that we can have something that looks like what the situation is in Japan, where some of these decisions aren't so difficult because you have greater capacity. And so I think that to have an answer to that problem, public health is expensive, but what's really expensive is not having public health. And that point that Dr. Rodriguez made is you can't separate healthy people and a healthy economy. We have to have both. And so I think that a more robust public health response will make some of those extreme measures less necessary.
Yeah, I mean, I think it's a fascinating question, and this is where you find different people on different sides of the political spectrum in places where they might not normally be. So in the United States, I think it's important to track like which groups of people have been most vocal in protesting against their denial of civil rights, and they tend to be white, armed people who have staged these protests. Not exactly like if you had to do a cross-section of US society, the most disempowered citizens that we have. So it's hard because that's kind of been characterized as the people pushing for civil liberties. But I think it is an important thing to keep track of, like to what extent the government, the police, et cetera, take advantage of this moment to take away other kinds of civil liberties. And in places like Brazil or Cuba, which are already kind of authoritarian places, you have to worry about that even more, like the extent to which the government uses this as an opportunity. But it reminds me of something we haven't talked a lot about, which is race, and the way in which race in Latin America and also the United States, different groups are impacted differentially. And frankly, I don't know in Latin America how that's played out. In the United States, it's very clear that Black African American communities have been disproportionately affected, and I would assume that the same is true in Latin America, that Black indigenous communities would be disproportionately affected.
Any other questions?
There's one on the chat. What is the role of citizenship? This is from Maria Teresa, not the legal one, but the one related to being part of a community in Latin America in the current COVID crisis.
Yeah, I can answer a little bit about that, in the sense if you mean by being part of a community. I think one of the responses precisely in the lower income neighborhoods in Argentina, and in fact the government has encouraged this. The current government probably would not have been encouraged by the previous government, but the current government has encouraged and has supported a lot of community-based comedores públicos, for example. So responses that have a lot to do with community grassroots organizations actually taking charge and making sure that people have food, and that there are some information is disseminated, and there's some controls that are enforced at the local level, of the local community. The government has encouraged that, and I don't know how well these things function or not, but so in that sense, that's definitely something that has worked that seems to be working to the benefit of people. There's a long history in Argentina and Latin America in general of community cooperation, right? In the face of repeated economic crisis and sometimes political crisis. So there's a long history of people coming together in solidarity under these external situations as well.
Yeah, and just in relationship to citizenship, this is in the more formal sense. If we think about the ways in which our policies in the United States have kind of excluded a lot of the undocumented people who aren't eligible for the benefits, and some states have tried to make up that, provide some aid to those people, but those are precisely the people who are on the front lines of the crisis, people working in restaurants, people in the agricultural sector or healthcare sector. And so I think that broader notions of citizenship beyond the legal and mutual aid is key. I would just plug a book that a colleague of mine, Magali Rabasa, just came out with. They did this book in the last 2 months on global mutual aid efforts. So if you look up her name, Magali Rabasa, you'll find it.
Okay, well, I think we have gone over time. And Shawn, you wanted to add something about that?
No, I really have enjoyed this panel, and I'm really grateful to everyone. Thank you.
Yes.
Yeah, thank you, Polo, for organizing it, and Shawn, and thank you all for participating.
Thank you, Elliott and Shawn and Elena, for moderating the questions, and for everybody that joined us today. It was fun, and hopefully everybody learned something. I certainly did.